Hi everyone, it's John here. I'm a transfusion-dependent thalassemia major patient, 52 years old, and I just want to go over the exclusion criteria for Zynteglo gene therapy, at least according to Cigna, which is my insurer. It's probably pretty similar with all the insurance companies, but I just wanted to go over that. So first of all, I'm just going to kind of read these off. You know, a lot of people, it's probably easier for them to hear the video and me describing the exclusion criteria. So the first one is you have to have transfusion-dependent thalassemia, beta thalassemia, obviously, and you have to be over the age of 4. The upper age limit is no longer a factor. The next thing is you cannot have had previous gene therapy, you know, for beta thalassemia in the past. The next one, you know, it has to be, your physician has to state that this is an appropriate treatment for you for your beta thalassemia. You know, of course, that requires a consultation from like your local hematologist to a thalassemia bone marrow transplant specialist, and not necessarily a thalassemia bone marrow transplant specialist, but a bone marrow transplant specialist. And they will determine whether this Zynteglo therapy is good for you. The next one is the patient has to meet one of the following criteria. You have to either not have an HLA-typed matching donor, or else, if you do have an HLA-type matching donor, they either are unwilling to provide you, you know, with their cells, or they have to be unwilling to provide you with their cells. So that's the next exclusion criteria. After that, it is you have to have, you know, your genotyping done to confirm what type of thalassemia you have. For example, beta 0, beta plus beta 0, beta E, beta plus, and et cetera, et cetera. So that's another thing. The next thing is patient is transfusion dependent as defined by meeting one of the following. Receipt of transfusions of greater than 100 milliliters of PEC cells per kilogram of body weight per year in the previous 2 years. Documentation is required. Or receipt of transfusions 8 or more times per year in the previous 2 years. Documentation required. And patient meets both of the following criteria. Patient has been evaluated for the presence of severe iron overload. Documentation required. And patient does not have evidence of severe iron overload. They're going to check your ferritin levels. They're going to check your liver MRI, your cardiac MRI, the T2 star. As many of you probably already have that done yearly, you know, if you're considering this gene therapy, or else you should. The next one is, let's see. Oh, as far as a higher liver iron concentration, if, you know, greater than 15 milligrams per kilogram, you're excluded. Or if your liver biopsy results suggest abnormalities, or if there's clinical evidence of organ abnormalities with your lab work or a liver MRI. The next one is patient does not currently have an active bacterial, viral, or fungal infection. They're going to draw a whole slew of labs when you go for your consultation. So you know, you have to prove that you don't have any of those things. And patient does not have a prior or current malignancy, myeloproliferative disorder, like a blood cancer, or a significant immunodeficiency disorder like HIV. This does not include adequately treated colon biopsy, in situ carcinoma of the cervix, uteri, and basal squamous cell carcinoma of the skin. Advanced liver disease, documentation is required. That's an exclusionary criteria. Examples include elevated transaminase levels, AST, ALT, bilirubin, and in fact, a direct bilirubin value greater than 3 times upper limit of normal, active hepatitis, extensive bridging fibrosis or cirrhosis are exclusion criteria as well. It's a long list, you know, bear with me. But, and also, according to the prescribing physician, the patient will have, will undergo mobilization, apheresis, and myeloablative conditioning. So, you know, I had my apheresis done to where they took my stem cells, and, you know, this is over a period of 3 days. They they took my stem cells out. But before that, I had, a stem cell activator. So I did that for like 3 days before my stem cell transplant, and before my apheresis, and I continued that for another 3 days into my apheresis, or 2 days, something like that. But then I also received another medicine called Plerixafor to push those cells into my bone marrow so that they could collect all of those in the apheresis. So yeah, that was pretty cool. But that's definitely a requirement to have the Zynteglo gene therapy. You have to have the stem cell mobilization, and they have to collect an adequate number of stem cells. So there is a chemotherapeutic agent for myeloablative conditioning. It's called busulfan, and that's one of the criteria. You have to get that, which is, that's obvious. And total hemoglobin level is greater than 11 at both of the following time points: prior to mobilization of your stem cells before the apheresis, and prior to the myeloablative conditioning. So when I go back in March for my treatment, my hemoglobin will have had to be greater than 11, for about a month. So as it did before my apheresis as well. Prior to the collection of cells for manufacturing, cellular screening is negative for all of the following: human HIV virus 1 and 2, hepatitis B virus, hepatitis C virus, and HTLV virus 1 and 2. Those are exclusionary criteria also. Documentation required for all of that stuff. According to the prescribing physician, the patient meets one of the following. A female reproductive potential meets both of the following, A and B. A negative serum pregnancy test, obviously, will be confirmed prior to the start of mobilization and reconfirmed prior to myeloablative conditioning. And the patient will use an effective method of contraception from the start of mobilization through at least 6 months after the administration of Zynteglo. So, that's for females, obviously. A male of reproductive potential will use an effective method of contraception from the start of mobilization through at least 6 months after administration of Zynteglo. And the medication prescribed by the hematologist or stem cell transplant specialist physician, and the current patient body weight has been obtained within 30 days. If concurrent use of Reblozyl also, prior to your stem cell mobilization and therapy. So I hope all that stuff helps. It's a lot of information. I was reading a lot because, it's hard to memorize all that stuff. Even though I pretty much know it, it's hard to rattle all that stuff off. So, I hope this helps, and I really hope it helps you determine whether you're a good candidate for the Zynteglo gene therapy.